using artificial intelligence in the outpatient departments like OPDs for doctors. Okay, so you can see there are two sample patients, and one of which is a little bit complex patient. And let's see how artificial intelligence is going to help you manage this patient. Okay, so this is a 38 years old patient with progressive fatigue, brain fog, migrating joint pain for the last 4 months. She has shown up in your clinic, and now you are tasked with helping her, right? So you're going to have to prescribe her, order investigations, imaging, counsel her, everything. Okay, so history of presenting illness, you can use a certain format to collect the information. So this patient with gradual onset of exhaustion not relieved by rest, she describes intermittent swelling in her small joints. This is very common in the outpatient department. Low grade fever in the evenings, and there is a butterfly rash on the cheeks. Okay, no allergies, no medication. This is 38. The age is 38 years old, and this is probably the first presentation for the patient. Vitals, you can see blood pressure is high, is up. Random blood sugar is 185. Okay, so this patient is a little bit complex. How are we gonna manage? Let's call in the artificial intelligence. Okay, now we need help managing the patient as well as to educate ourselves. Okay, to make sure we are not missing anything, our prescription is medical legally safe and sound. So all of those things all in one. What is the diagnostic logic for this patient? Progressive fatigue, brain fog, all of these suggest SLE or other connective disease. Hidden conditions to rule out include rheumatoid arthritis, I don't know how to pronounce this, S. Sjogren syndrome, other autoimmune disorders, viral arthritis. And then, it's suggesting you do these things. And then we got this editable draft here. Okay, this is editable draft. Okay, that's clinical presentation labs. In the labs, you have CBC, ESR, CRP, ANA, anti-dsDNA, anti-Smith, rheumatoid factor, anti-CCP, urinalysis to check for proteinuria, hematuria, LFT, RFT, blood fasting, HbA1c, and complement levels. Also, let's order TFT. So whatever you edit, it gets added to the final document that you're gonna hand over to the patient. Okay, let's check the prescribed medications. Hydroxychloroquine to be reviewed, yes, and we should refer this patient to the ophthalmologist. Okay, so we have referral to rheumatologist, endocrinologist, and let's check eyes. Ophthalmologist referral, just to have a baseline eye checkup. Okay, and then you prescribe hydroxychloroquine, paracetamol for pain, and then metformin. You have to first confirm the diabetes. Okay, and then you can start this. Maybe I don't want to start it right away. I'll call this patient next day to check for fasting and postprandial sugars. Also send the HbA1c. Okay, so let's see if we have sent the HbA1c here. Yes, we already sent the HbA1c. And then for the losartan, I want to check the renal function test. Okay, if the creatinine is up, then I maybe not want to start this. I'll use something else. And I also need to check the blood pressure, hypertension first. So I must confirm before I start this medication. So I'm just gonna delete it at the moment, but I know that I may have to start this medication at the next visit, maybe in a couple of days. Okay, until that, I will give the patient a home BP machine, and then maybe she can check her blood pressure at home a couple of times 3-4 times to confirm and record the blood pressure, bring it next time for the diagnosis. Okay, so there are instructions for the patient, you can add, edit, and there is patient education as well. Okay, so in the language you can choose the language. Okay, so right, and then now let me see, I want to print this off. Okay, so here is the prescription in a minute. So all the information here, provisional diagnosis, and then labs, all the labs here, all the imaging here. Okay, it's all editable. Okay, and this is sample doctor and sample patient, complex. You can add your signature and all those things, right? And there is also, like on this page there is a clinical intelligence hub. So what this basically, this is a deep dive into the patient profile. On the subsequent visits, when you add these lab reports, okay, so this system is going to process all that information, adjust the medications, and will give you more detailed analysis. So you see summary, then red flags in this patient: progressive fatigue, brain fog, migrating joint pains, malar rash, oral ulcers, blood pressure, sugar, maybe cardiovascular metabolic risk. Okay, nutritional deficiency may be there. So these are the things you need to monitor and intervene. Priority interventions. It gives you all these, the list of the interventions. Okay, let's go through some of these. Detailed history. So it's asking you to take a detailed history on pattern, severity of joint pains, photosensitivity, genital ulcers, alopecia, Raynaud's phenomena, weight loss, right? Examination, you have to check for musculoskeletal, dermatological, anywhere else you see any ulcers, anything else, any neurological issues, because this is autoimmune condition, right? Or you're already ordering the tests, you asked her to monitor her blood pressure, and you have counseled her. You see in the prescription, like here. Okay, so follow-up test, medication rationale. If there are any medications, it's gonna check if there are any interactions, all those things. So this happens when you keep on adding more information on subsequent visits. It's gonna process all that information to help you best manage the patient. Okay, latest evidences and all those things. So this is clinical decision support, and this is the generated prescription in 2 minutes, complex patient with all the prescription, everything with few clicks. And on this channel we're gonna do other different OPD patients. Okay, stay tuned. Thank you so much.